Have you ever wondered what accelerated idioventricular rhythm is? It's not something that comes up in everyday conversation, but it's an intriguing concept in the field of medicine. Let's delve into it. Accelerated idioventricular rhythm, commonly abbreviated as AIVR, is a condition that occurs when the pace of an ectopic ventricular pacemaker surpasses that of the sinus node. In simpler terms, it's when the heart's natural pacemaker is outpaced by another part of the heart. AIVR is often associated with an increase in vagal tone, which is the activity of the vagus nerve, and a decrease in sympathetic tone, which is part of the body's fight-or-flight response. This unique rhythm of the heart can give us a lot of intriguing insights into how the heart functions. So you see, AIVR is an intriguing concept, and understanding it can give us a lot of insight into the workings of the heart. Now that we know what AIVR is, let's delve into what causes it. Accelerated idioventricular rhythm, or AIVR, can be triggered by a variety of factors. One such factor is AV dissociation, where the sinus and ventricular complexes occur at identical rates. This can create a rhythm that surpasses the normal pace set by the sinus node. Another cause of AIVR is isorhythmic AV dissociation. This happens when there's a functional block at the AV node. In simpler terms, a blockage prevents the normal flow of electrical signals from the atria to the ventricles. This can result in the ventricles setting their own pace, separate from the sinus node. Yet another cause is the competition between sinus and idioventricular pacemakers. When both pacemakers vie for control, the idioventricular pacemaker might win out, leading to an accelerated rhythm. AIVR can also occur following reperfusion after an anterior STEMI, a type of heart attack. This is when blood flow to the heart muscle is restored after a blockage. The sudden rush of blood can cause the heart's rhythm to accelerate. In newborns, AIVR can be quite benign, meaning it's not harmful or severe. It can occur with or without congenital heart disease, a type of heart defect present at birth. Even though it may not pose immediate danger, it's essential to monitor and manage it effectively. Understanding the causes of AIVR allows us to better diagnose and treat this condition. AIVR isn't the only rhythm out there, so how do we distinguish it from others? Accelerated idioventricular rhythm, known as AIVR, is unique in its own ways. One of the most striking characteristics that sets AIVR apart from other rhythms is its rate. In a healthy heart, the rate of the sinus node, our heart's natural pacemaker, is usually faster than that of an ectopic ventricular pacemaker. However, in AIVR, the tables are turned. The rate of the ectopic ventricular pacemaker surpasses that of the sinus node, leading to this distinctive rhythm. But why is it important to distinguish AIVR from other rhythms? Well, in the world of medicine, accurate diagnosis is key to effective treatment. Misinterpreting AIVR for another rhythm could lead to inappropriate treatments and further complications. For example, if AIVR is mistaken for ventricular tachycardia, an individual might receive unnecessary aggressive treatments like defibrillation or antiarrhythmic drugs. So how can we ensure we're correctly identifying AIVR? It's all about the details. AIVR is associated with increased vagal tone and decreased sympathetic tone. It can also occur in conjunction with other conditions like following reperfusion from an anterior STEMI. In newborns, AIVR can be benign with or without congenital heart disease. This makes understanding the nuances of this rhythm even more critical. The more we know, the better equipped we are to provide the right treatment and care. Being able to distinguish AIVR from other rhythms is crucial in the field of medicine. Let's recap what we've learned about AIVR. Accelerated idioventricular rhythm, or AIVR, is a condition that occurs when the pace of an ectopic ventricular pacemaker surpasses that of the sinus node. This rhythm is often associated with increased vagal tone and decreased sympathetic tone. The unique rate of AIVR helps distinguish it from other rhythms with similar morphology. We've also discussed several causes of AIVR. It can occur due to AV dissociation, where sinus and ventricular complexes occur at the same rates, or due to isorhythmic AV dissociation caused by a functional block at the AV node. AIVR can also result from competing sinus and idioventricular pacemakers, or it may occur following reperfusion from an anterior STEMI. Remember, in newborns, AIVR can be a benign entity with or without congenital heart disease. With this knowledge, you're now better equipped to understand and discuss accelerated idioventricular rhythm. Now that we've covered the basics of AIVR, let's dive deeper into some practical aspects. How do you manage a patient with accelerated idioventricular rhythm? Generally, AIVR is a benign rhythm that requires no specific treatment. However, it's important to treat any underlying causes that might have triggered the rhythm. For example, if the patient has suffered a myocardial infarction, appropriate cardiac care should be provided. In neonates, it's important to monitor the rhythm, as it can sometimes signal congenital heart disease. In the absence of symptoms, no treatment is necessary, but if symptoms are present, they should be treated accordingly. Furthermore, it's crucial to educate the patient about AIVR, its implications, and its management. This will empower them to take an active role in their health care, leading to better outcomes.